What if one of the quietest health habits in your life was not about what you eat, what you drink, or how many steps you take, but about the way your body rests for 7 or 8 hours every night? Most people think of sleep as a pause button. But after 60, sleep is a long stretch of time when your heart, blood vessels, lungs, brain veins, and nervous system are still working without your conscious control. During those hours, your blood is still moving. Your heart is still pumping. Fluid is shifting through your legs, chest, and neck. Your breathing pattern can change. Your blood pressure can rise, fall, or fail to drop the way it should. And for some older adults, the position they sleep in can make that nighttime work either easier or harder. This does not mean that one sleep position can magically prevent a stroke. It does not mean that a pillow can replace medication, medical care, exercise, or a proper diagnosis. But it does mean something very important. The mechanical position of your body can influence pressure, breathing, reflux, circulation, comfort, swelling, and how much strain your cardiovascular system may experience during the night. And because older adults spend so much of life sleeping, even small repeated stresses can matter over time. Today we are going to talk about sleep position and cardiovascular health after 60 in a practical, responsible way. No miracle claims, no fear tactics, no product to sell, just a clear explanation of why some positions can create problems for certain people, why others may feel easier on the heart and circulation, and how to set up your body at night in a way that supports comfort, blood flow, breathing, and safer sleep. The most important idea is simple. For many seniors, sleeping on the left side with the upper body slightly elevated, the knees supported, and the legs drained before bed may be a more circulation-friendly setup than sleeping flat, curled, twisted, or face down. Let us start with circulation. Your veins have a difficult job. Arteries carry blood away from the heart under pressure. Veins bring blood back. Blood from the feet and lower legs has to travel upward toward the heart, often against gravity, through vessels that may not be as elastic as they once were. Muscles in the calves help push that blood upward during the day when you walk. But at night, when you are still, the pumping action of the legs slows down. If fluid has collected in the ankles or calves by evening, the body has to redistribute that fluid when you lie down. This is one reason many seniors notice swollen ankles at the end of the day, then wake during the night to urinate. Sometimes the problem is not only the bladder. Sometimes fluid that sat in the legs during the day returns to circulation after lying down, and the kidneys respond by making more urine. That can break sleep, increase fatigue, and create a cycle where the body never gets deep, steady rest. Now think about the heart. It beats all night, whether you are comfortable or not. If the chest is compressed, breathing is restricted, the neck is bent sharply, or the body is twisted in a way that makes circulation less efficient, the heart may have to work under less than ideal conditions for hours. One bad night may not be a crisis, but repeated nights of poor breathing, poor positioning, or poor circulation can add stress to a system that already needs protection. This is why sleeping position deserves attention, especially for adults over 60 who already have high blood pressure, heart disease, atrial fibrillation, diabetes, circulation problems, leg swelling, sleep apnea, reflux, or a history of stroke, TIA, or blood clot. Again, position is not the whole story. It is one piece of the larger picture, but it is a piece many people can improve without medication, without a prescription, and without dramatic lifestyle changes. Let me describe 3 common positions that may create problems for some seniors. The first is stomach sleeping. For younger people, sleeping on the stomach may only cause neck soreness or back stiffness. But in older adults, it can create several issues at once. The chest presses into the mattress. The neck has to rotate to one side for breathing. The lower back may arch, the shoulders may tighten. If someone already has limited neck mobility, carotid artery disease, reflux, breathing problems, or spinal pain, this position can be especially uncomfortable. The concern is not that stomach sleeping instantly causes a stroke. That would be too strong. The concern is that it can place the neck, chest, and breathing mechanics in a poor position for many hours. The second position is flat back sleeping. Back sleeping is not always bad. For some people, especially with the right pillow and elevation, it can be comfortable. But for many adults over 60, Sleeping completely flat on the back can worsen snoring, obstructive sleep apnea, reflux, and nighttime breathing interruptions. When the airway narrows during sleep, oxygen levels may drop and the body may respond with stress signals, pressure changes, and repeated awakenings. If you wake up gasping, snore heavily, feel exhausted despite sleeping, or have morning headaches, you should talk with a healthcare professional about sleep apnea. Changing position may help some people, but it is not a substitute for evaluation. The third position is right side sleeping, especially when the body is curled tightly or the shoulder and chest are compressed. Right side sleeping is not automatically dangerous. Many people do it safely, but some people notice more palpitations, reflux discomfort, shoulder pressure, or breathing discomfort on one side compared with the other. The heart sits slightly left of center. The stomach and esophagus have their own shape, and the position of the chest and abdomen can influence how comfortable the body feels. For certain people, left side sleeping may reduce reflux and feel easier for breathing and circulation. For others, especially people with specific heart failure symptoms or medical conditions, the best position may differ. That is why your symptoms matter. Now let us talk about the position that many seniors may find most supportive: left side sleeping with slight upper body elevation. The left side has practical advantages. It can reduce reflux for many people because of the position of the stomach and esophagus. Less reflux can mean fewer nighttime awakenings, less coughing, less throat irritation, and less strain from repeated discomfort. Left side sleeping can also feel more natural for circulation in some people because it allows the body to rest without compressing the chest in the same way stomach sleeping does. It also gives you an easy way to support the knees, hips, and spine so the lower body stays aligned. But the real benefit comes from the full setup, not just rolling to the left and hoping for the best. A proper sleep setup has 4 parts. First, elevate the upper body slightly. The key word is slightly. You are not trying to sleep sitting straight up. You are trying to raise the upper body enough to support breathing, reduce reflux, and avoid lying completely flat. For many people, this means a gentle wedge or a modest incline of the bed, not a pile of soft pillows under the head. Stacking pillows under only the neck can bend the head forward, compress the throat, strain the neck, and leave the chest flat. That is not the same as upper body elevation. The elevation should begin under the upper back and torso, not just behind the skull. Second, support the knees. When you sleep on your side without a pillow between the knees, the top leg can fall forward and rotate the pelvis. That twist can increase low back strain and may compress the hip or groin area. A firm pillow between the knees keeps the hips stacked and the spine more neutral. This is not just about comfort. Good alignment helps you stay in the position longer without waking up sore and rolling into a worse position. Third, support the rib cage and shoulder. Many older adults avoid side sleeping because their shoulder hurts. A small pillow, folded towel, or body pillow can help support the chest and upper arm so the shoulder is not crushed under the body. The goal is to feel stable, not trapped. You should be able to breathe freely, keep the neck neutral, and avoid pressure points. Fourth, choose the correct head pillow height. Your head pillow should keep your neck in line with the rest of your spine. If the pillow is too low, your head drops downward. If it is too high, your neck bends upward. Either one can create morning headache, neck pain, dizziness, or a feeling of poor sleep. When lying on your side, imagine a straight line from the top of your neck through the center of your spine. That is what you are aiming for. Let me give you a practical example. Imagine a 72-year-old woman named Margaret. She has high blood pressure, mild ankle swelling, and reflux after dinner. She sleeps mostly on her back with 2 pillows under her head. Every morning she wakes with a dry throat, heavy legs, and stiffness across the shoulders. Her doctor has adjusted her medications, but nobody has asked about her sleep position. When Margaret changes to a gentle left side setup, uses a pillow between her knees, raises her upper body with a wedge, and lifts her legs for a short time before bed, she may not cure anything overnight, but she may notice less reflux, fewer awakenings, less morning heaviness, and a more comfortable night. Now let us talk about the pre-sleep leg elevation routine, because this is one of the most useful habits for seniors with evening ankle swelling or heavy legs. During the day, fluid can collect in the lower legs. This may happen because of long-sitting, long-standing vein weakness medications, heart conditions, kidney issues, salt intake, heat, or simple age-related circulation changes. If your ankles swell often, you should discuss it with a healthcare provider, especially if the swelling is new, one-sided, painful, red, or associated with shortness of breath. But for many people with mild, familiar evening swelling, a simple routine may help. About 30 to 60 minutes before bed, lie down and elevate your legs above heart level for 10 to 15 minutes. You can use pillows, a cushion, a sofa arm, or a wall. Keep it comfortable. Do not force the knees straight if that hurts. Do not hold a position that causes numbness or pain. The goal is gentle drainage. Gravity helps fluid move back towards central circulation before you go to sleep, rather than waiting for that redistribution to happen at 2 o'clock in the morning. Some people notice fewer bathroom trips, less morning ankle swelling, or lighter legs. Not everyone responds the same way, and anyone with heart failure, severe swelling, kidney disease, shortness of breath, or a history of clots should ask their clinician what is appropriate. But as a mechanical habit, gentle leg elevation is one of the simplest circulation supporting routines many seniors can try. Now, I want to address something important. If you have had a stroke, TIA, pulmonary embolism, deep vein thrombosis, atrial fibrillation, heart failure, severe sleep apnea, or uncontrolled blood pressure, do not treat this video as a replacement for medical care. Positioning can support the body, but it does not replace blood thinners when they are needed. It does not replace CPAP for sleep apnea. It does not replace blood pressure medication. It does not replace urgent care if you have warning symptoms. Think of sleep position as a foundation habit, not a treatment plan by itself. With that said, foundation habits matter. A home can have expensive security systems, but if the door is left open every night, the basics still need attention. Your cardiovascular system is similar. Medication, tests, and doctor visits matter. But so do sleep, breathing, hydration, movement, posture, and the position you spend 1/3 of your life in. Let us go deeper into why nighttime is so important. Blood pressure has a daily rhythm. In many healthy patterns, pressure drops during sleep. This nighttime dip gives blood vessels and the heart a period of lower workload. Some people do not get that normal dip. Others have blood pressure that rises during sleep. This can be related to sleep apnea, stress, pain, medications, kidney disease, alcohol, poor sleep quality, or other health factors. You cannot know your nighttime pattern just by guessing. But you can pay attention to clues: morning headaches, waking with a racing heart, nighttime breathlessness, heavy snoring, frequent urination, and feeling exhausted on waking. A better sleep position will not solve every one of those issues, but a poor sleep position can make some of them worse. If lying flat worsens breathing, then elevating the upper body may help. If reflux wakes you repeatedly, left side sleeping and elevation may help. If hip pain forces you to roll all night, knee support may help. If ankle fluid shifts suddenly after lying down, leg elevation before bed may help. Each change is small. Together, they can create a more stable night. Now here is the step-by-step setup. Tonight, do not try to create the perfect medical-grade sleep system. Start simply. Before bed, elevate your legs for 10 to 15 minutes. Lie comfortably and breathe slowly. This is not exercise, it is drainage and decompression. When you get into bed, lie on your left side. Place a firm pillow between your knees so your hips are stacked. Put a pillow in front of your chest to rest your top arm or hug a body pillow. This prevents your shoulder from collapsing inward. Use a head pillow that keeps your neck straight. If you have a wedge pillow, use it under the upper back and torso. If not, use temporary support for a few nights, but do not rely on a stack of soft pillows under only the head as your long-term solution. During the first few nights, your body may resist. That is normal. Decades of sleep habits do not change instantly. If you wake up on your back or right side, reset gently. The goal is not perfection, it is training. Your nervous system learns by repetition. After 3 nights, add better support. A firmer knee pillow, a body pillow, a small towel for the rib cage or shoulder, better wedge elevation if needed. Adjust one thing at a time so you can tell what helps and what irritates your body. After 1 week, track 4 things in the morning: ankle swelling, bathroom trips, reflux symptoms, and energy. Write it down. Did you wake up twice or 4 times? Were your legs heavy or normal? Did your throat burn? Did you feel clear or foggy? These clues tell you whether the setup is working for your body. Now let us talk about mistakes. Mistake number 1, lifting only the head. This is probably the most common error. People hear elevate and put 2 or 3 pillows under the head. The neck bends, the chin moves toward the chest. The airway can become narrower, the shoulders stay flat, the person wakes up with stiffness and thinks elevation failed. It did not fail. The setup was wrong. Mistake number 2, using a pillow that is too high. A thick pillow can bend the neck all night. This may cause headaches, jaw tension, shoulder pain, or numbness. On your side, your pillow should fill the space between the mattress and your head without pushing your neck up or letting it sag down. Mistake number 3, ignoring sleep apnea. If you snore loudly, stop breathing during sleep, wake choking, feel sleepy during the day, or have morning headaches, get evaluated. Position can influence sleep apnea, but it is not enough for everyone. Untreated sleep apnea is a serious cardiovascular stressor, especially for people with high blood pressure or heart rhythm problems. Mistake number 4, forcing left side sleeping when it clearly worsens symptoms. Most people can experiment safely with position, but not everyone feels better on the same side. Some people with heart failure, shoulder injuries, severe arthritis, or breathing conditions may prefer a different position. Your body gives feedback. Use it. If a position causes chest pain, severe shortness of breath, dizziness, numbness, or significant discomfort, stop and seek medical advice. Mistake number 5, expecting one night to prove everything. The body often needs time. Reflux may improve quickly. Shoulder comfort may require adjustments. Leg swelling may take several evenings of consistent elevation. Sleep habits are learned patterns. Give the setup a fair trial, but do not ignore warning signs. Now I want to speak directly to the person who is watching this because they are scared. Maybe you had a stroke scare. Maybe someone in your family had a blood clot. Maybe your legs swell every night and nobody has explained why. Maybe you wake with your heart pounding and every test keeps coming back normal, but you still know something does not feel right. That fear is real, but fear becomes useful only when it turns into action. You do not need to overhaul your life tonight. You do not need a perfect routine. You need one clear step. Start by getting your body out of the worst positions and into a more supported one. Left side if tolerated, upper body gently elevated, knees supported, neck neutral, legs elevated before bed. That is a practical beginning. Also, learn the warning signs that should never be handled with pillows or home routines. Sudden weakness on one side of the body, facial drooping, trouble speaking, sudden vision changes, sudden severe headache, chest pain, severe shortness of breath, coughing blood, fainting, or sudden painful swelling in one leg are urgent symptoms. Do not wait to see if sleep position helps. Get emergency help. For everyone else, the quiet work starts tonight. Let me give you a 30-day challenge, but I want it to be realistic. For the next 30 nights, commit to improving your sleep position. Not perfectly, consistently. Night 1. Raise your legs for 10 minutes before bed and sleep with a pillow between your knees. Night 2. Try left side sleeping for the first part of the night. Night 3. Check your head pillow height and keep your neck neutral. Night 4. Add support in front of your chest or under your top arm. Night 5 and beyond. Work toward gentle upper body elevation that supports the torso, not just the head. By the end of the first week, you should know what feels better and what needs adjustment. By the end of 2 weeks, the position may begin to feel more natural. By the end of 30 days, you will have real personal information, whether your reflux improved, whether your legs feel lighter, whether morning energy changed, whether bathroom trips decreased, and whether your sleep feels more stable. This is not about chasing perfection. It is about removing unnecessary strain, and that point matters because many seniors have been told that everything they feel is just aging. Heavy legs? Just aging. Waking tired? Just aging. Palpitations at night? Just anxiety. Morning headaches? Just dehydration. Sometimes those explanations are partly true, but often the full picture is more mechanical, more practical, and more fixable than people realize. Aging changes the body, but aging does not mean every discomfort should be ignored. Your body still responds to better conditions. It responds to movement. It responds to alignment. It responds to breathing support. It responds to less pressure, less twisting, and better fluid movement. You are not helpless while you sleep. You can design the environment your body spends the night in. Before we finish, let us put the whole routine into one simple checklist. First, avoid stomach sleeping if possible, especially if it causes neck strain, chest pressure, or back pain. Second, be cautious with flat back sleeping if you snore heavily, have reflux, or suspect sleep apnea. Third, try left side sleeping if it is comfortable for you. Fourth, elevate the upper body gently from the torso, not only from the head. Fifth, place a firm pillow between the knees. Sixth, support the chest, shoulder, and upper arm so you do not collapse forward. Seventh, keep the neck neutral with the right pillow height. Eighth, elevate the legs for 10 to 15 minutes before bed if you deal with evening swelling or heavy legs, unless your clinician has told you not to. Ninth, track your results for 30 days. 10th, talk with your healthcare provider if symptoms are severe, new, one-sided, worsening, or connected to breathing problems, chest symptoms, neurological symptoms, or a history of clots or stroke. It is simple, but simple does not mean useless. Many of the most protective habits are not dramatic. Walking is simple. Taking medication correctly is simple. Drinking enough water is simple. Checking blood pressure correctly is simple. Sleeping in a position that supports breathing and circulation is another one of those basic habits that can be easy to overlook because it does not feel medical enough. But your body does not care whether a habit looks impressive. It cares whether the habit reduces strain. So tonight, before you turn off the light, pay attention. Look at your pillow. Look at your leg position. Look at whether your body is twisted, compressed, flat, or supported. Ask yourself, am I making the night easier for my heart, my lungs, my veins, and my brain, or am I forcing them to work around poor positioning for the next 8 hours? Sleep should be a place of repair, but repair works better when the body is not fighting the mattress, pillow, airway, stomach, legs, and gravity all at once. Start small, left side if comfortable, knees supported, upper body slightly elevated, legs raised before bed, neck straight, breathing easy, no force, no fear, just better mechanics. If you take blood pressure medication, blood thinners, heart rhythm medication, diuretics, or any treatment for stroke risk, do not change anything without your doctor. If you have a medical condition that affects your heart, lungs, kidneys, veins, or brain, ask your clinician which sleep position is best for you. This information is educational and meant to help you ask better questions and build safer habits, not diagnose or treat disease on your own. Now I want you to make one decision, not someday, tonight. Choose one change you can actually do. Maybe it is the knee pillow. Maybe it is 10 minutes of leg elevation. Maybe it is stopping the habit of sleeping flat on your stomach. Maybe it is finally asking your doctor about sleep apnea because your snoring has been ignored for years. One change is enough to begin. And if this helped you, share it with someone over 60 who wakes with swollen ankles, reflux, morning headaches, heavy legs, or fear about stroke and heart health. They may never search for this information themselves, but one message from you could help them look at sleep differently. Your next 8 hours matter. They are not empty hours. They are hours when your heart is working, your blood is moving, your lungs are breathing, and your brain is recovering. Give your body a better position to do that work. I am not asking you to believe in a miracle. I am asking you to respect the mechanics of your own body. Try the setup for 30 nights. Track what changes. Talk with your doctor where needed. And remember this, getting older does not mean giving up control over the small things that still support your health. Sometimes the most meaningful change begins with how you lie down tonight.